to reduce the friction for us as healthcare systems, but also for the patients ultimately as well. So we did a very specific type of challenge, which we based on the Shark Tank model, where we had CEOs and leadership from our hospital system and the Blue Cross Blue Shield side. We also involved the city of Baltimore. We had our health commissioner, Dr. Letitia Zaraza, participate as a judge. And we were amazed at the reception that we got. We expected maybe 20 or 30 applications. We ended up receiving over 100 applications from all over the United States and Israel and Canada as well.
Wow.
And we had to narrow it down to 6 finalists for the competition, and selected a winner based on the judges and based on the pitches from the day. So the winner was a Washington, D.C. analytics firm called Socially Determined that looks at the social determinants of health and how they affect patients' lives outside of our hospital. So looking at issues like homelessness, addiction, transportation challenges, so that our care managers can better triage the patients and connect them with community-based organizations to help the patients, because we realize that a lot of the health factors that impact patients are happening outside the hospital. So the more we understand and integrate that into our care management approach, the better we think the overall healthcare outcomes will be. And as our industry moves from a fee-for-service model to a value-based care model in the United States, it's becoming increasingly important for us to focus on outcomes and show the value that we're delivering to patients. So the innovation challenge that we did is just one example of how we are trying to reduce the friction and connect with the startups that meet the needs of our healthcare system. Another thing that we have done within our department is have office hours for local startups to come in and speak with myself and with our Chief Innovation Officer, connect them with funding opportunities to help fund the pilots to get from that 6-month or 1-year stage to the enterprise level contract can be quite challenging. So we are trying to make ourselves more available to connect with entrepreneurs. And in those office hours, sometimes we'll bring in clinicians as well to give the clinical feedback that, hey, this technology is awesome. We would love to use virtual reality headsets or AI around some type of ambient environment. Those could be really good solutions, but it doesn't meet our need today, right now. Right now, I have a much more specific need around just diagnosing a particular type of condition or improving our time so that we can be more efficient and improve our throughput time. So we're offering more channels and more opportunities to bring our innovation leaders and our clinical leaders face-to-face with entrepreneurs.